Thank you all very much for joining us. My name is Mrna Miracle. I'm an Assistant Public Information Officer working in the Humboldt County Joint Information Center. We're here with County Health Officer Dr. Ian Hoffman and Public Health Director Michelle Stevens. Our goal today is to cover as much information on the county's vaccination efforts as possible in the time allowed. I'll call on each outlet one at a time, and the reporter will have the chance to ask a question with a few follow-ups. Please try to limit your conversation with doctor and director to a single topic. If other reporters have follow-ups on that topic, please raise your hand through Zoom, and we'll take those after the initial conversation. We can extend a bit beyond 1 p.m. if needed. But first, we'll begin with Dr. Hoffman providing a brief update on the county's COVID-19 vaccine efforts. Dr. Hoffman?
Thank you, Mariah. Thank you for everyone for participating today. So as you all know, we first started hearing about vaccine for COVID-19 throughout the summer and really began planning for this moment 4 months before the vaccine arrived here. We first received vaccine in the middle of December and started pushing it out to our partners in healthcare here in Humboldt County to allow them to begin vaccinating the phase 1A workers in Humboldt County who work in hospitals and clinics and other healthcare entities. Throughout the last month, we have continued that effort in phase 1A, and we are nearing completion of phase 1A. As of today, we have enough vaccine in the county to cover all of the phase 1A workers who would like to receive a vaccine. So what are the next steps in this plan after we have finished the phase 1A healthcare workers? So if any of you have seen the plan, it's on our website, it's on the CDPH website. The next step in the plan is to move on to phase 1B. Phase 1B is made up of two categories of folks. It includes people based on their age, and it also includes other frontline workers who are working in our community out on the front lines every day. The age category in phase 1B, tier 1, is 75 years and older. We would like to announce that we are now opening phase 1B for ages 75 and older. The other groups in phase 1B are definitely going to be open as soon as we have enough vaccine in Humboldt County to do so. So the plan in terms of how these things are going to roll out to these populations include use of the resources in healthcare that already exist, such as our clinics and our hospitals, who have already been having great experiences with their vaccination clinics throughout the last month, and now can transition those to accommodate our general population of 75 years and older. The healthcare entities that are involved in this are aware and are preparing, and we will be making announcements next week through those groups and through public health on how you, as members of Humboldt County, will get your vaccine if you are 75 years and older. We will also use public health media and other media to identify when we open up the rest of the groups in phase 1B. Including 65 to 74-year-olds when there is enough vaccine available, and other work groups, essential workers, some frontline workers in phase 1B as vaccine becomes available and it becomes their turn in line to get the vaccine. So that's sort of where we started, where we went, and where we're at. But there was a big announcement this week that I also wanted to make mention of. As many of you are aware, on Tuesday, HHS at the federal level made an announcement that we would be adding, or changing, I should say, we would be changing the prioritization that had been set months and months before. That prioritization change included adding everyone 65 and older to phase 1A, or sorry, phase 1B tier 1, and including adding 16 to 64-year-olds with high-risk conditions. This was a large increase in that population, and the thought was that that would allow us to vaccinate faster. In addition to that announcement, they also announced increasing doses to states, which would then be given out to the local level. And those doses are coming from second doses that were held back to ensure that we had second doses. This plan would allow for increased rate of first doses, and with the hope that down the line there would be enough second doses to give. Throughout the day and that evening, there were discussions that happened at the state level through California on how to respond to this. And California adopted 65 and older into the phase 1B tier 1, but did not adopt 16 to 64-year-olds with high-risk conditions into that phase and tier. They also decided that it would be too early to stop shipping second doses, so they decided that we should continue our second dose effort. But they did decide that we could release up to 50% of those second doses as first doses if needed locally at the local level to continue vaccination efforts. So we had all this news coming down from both the federal and the state level, and then we had to look at our situation locally here in Humboldt County. Pulled together our leaders in healthcare and in government to survey and get people's opinion, and we decided that the plan was in place already for phase 1B with 75 and older, and that we would continue to follow that plan locally. And due to the fact that there is not enough vaccine currently available to open to all 65-year-olds in Humboldt County. And just to give you a sense of the scope of these different groups, phase 1A, workers comprise 10,000 members of our community in Humboldt County. So we've been able to offer vaccine to all of those people, and now we have enough vaccine to open up to the next group, which is 75 and older. 75 and older is also 10,000 members of our community. So you can see that currently we have 12,500 doses that have been shipped here to Humboldt County. Those include both first and second doses. So those are not all first doses. And we've given about 7,300 of those approximately. We have remaining around 5,200 doses in Humboldt County. Of those, 1,700 are first doses and 3,500 are second doses. We currently have around 3,100 appointments next week to give out vaccines. So you can see that our dose allocation has been designed to match the amount that we have on hand in the county. So what are the next steps? We have met with all the local healthcare leaders today to alert them to this plan. They're aware that we will be opening up phase 1B. They've been preparing for this for weeks. They're aware that in the coming days and weeks, they will be ramping up their clinics and sending out information to their patients to let them know when and where they can get their vaccine. Those who do not have a healthcare provider locally, we will accommodate for those people through a combination of public health and other community partners. These things, as I've said all along, are subject to change and have to be fluid based on the amount of vaccine that we're given. And the reason that we're going into our second doses is because of our the way that the federal government and the state are telling us they're going to be sending us more vaccine in the coming weeks than they have been in the previous weeks. So we're scaling up to match that with the needed number of appointments. So we're moving from about 1,000 to 2,000 doses a week to now likely potentially as much as 3,000 or 4,000 doses shipping per week. So we will do our best to continue to get this out there in a way that makes sense to people, in a way that is easily understood. And we will continue to work with our partners in healthcare to message when and where you are in line for the vaccine, and you know, when it does become your turn, how you can get the vaccine. Thank you.
Thank you, Dr. Hoffman. So we'll go ahead and move on to questions. We'll start with Thad Greenson from the North Coast Journal. Go ahead and ask you to unmute Thad.
Yeah, thank you. So I mean, I guess to start out, I'm curious if there have been any federal or state resources brought to bear to help with the actual administration of vaccines. I mean, are they providing any resources other than just delivering the vaccine itself?
We were early on in the effort. We were definitely given a lot of training on how to do mass vaccination pods or point of dispensing. And ways that we can help our partners in the community develop those pods and give out vaccine, you know, quickly. So that's the level of support, and also the vaccine.
Okay, and then I guess a follow-up to that is, you know, do healthcare provider staff have the or healthcare providers locally have the staff and resources on hand to really ramp up vaccine clinic efforts beyond vaccinating their own staff?
Yeah, it's a really great question, Thad. So we have worked with them to try to figure out ways to maximize the use of their staff. We also have a very large volunteer effort going on, and plan to utilize that to the best of our ability to augment all of these efforts. There are inklings from the state that we will get state resources in terms of manpower and other things to continue to administer as this gets bigger and bigger. You know, just to put into scope you know, what needs to happen though. At some point, to hit the goal of getting everyone who wants to get vaccinated in Humboldt County, to get them all vaccinated by, you know, summer, late summer, we would really need to be giving out close to 8,000 vaccines a week, first and second doses. So you can see the scale of that is extraordinarily large, and that we need to leverage every single aspect of our healthcare system to make it happen, including all of our partners, public health, and eventually state resources and potentially national resources that will come in as the effort grows in each step.
To your first question, Thad, if I may, the state, there's conversation at the state level about dispatching or deploying resources as in vaccinators to counties, but we don't have specifics yet in terms of how the request is made, how many people, and the logistics of that. So they are talking about and recognizing the need for additional vaccinators in certain counties.
But we also have to realize that this is going on in every single county and every single jurisdiction across the entire country.
Okay, excellent. Thank you, guys.
Thank you.
All right, Hank Sims from the Lost Coast Outpost. I'm going to ask you to unmute, Hank.
Okay, there we go. Hi. I guess just following up on Thad's questions a little bit. You know, we saw over the weekend, we saw Assemblymember Jim Woods tweeted a photo of himself vaccinating a teacher down in Ukiah. And it occurred to me that this is two things that are happening in this photo that are happening in Mendocino County that are not happening here. one, a teacher is getting vaccinated, and two, a dentist is doing the vaccination. So I'm wondering why, like, are other counties, why, for example, other counties are already taking appointments to get 65-year-old and up people vaccinated. Is it just the fact that we have less vaccine per capita than other counties, or are they doing something differently that allows people to get vaccinated faster?
Thank you, Hank. I don't know the specifics of the vaccine effort in Mendocino County, so I cannot speak directly to that. I think what I can speak to is the numbers that we have here. 10,000 healthcare workers. I imagine that's quite a few more than Mendocino, but I just don't know. We have offered those folks vaccine. We are moving on to the next group, which is 75 and older. And when we have sufficiently started that, we will very likely start with teachers next.
I guess you know the question is, surely you're looking at, surely you must be talking to other counties about how they're arranging this. And I just want, like, you must be talking with other health directors in other parts of the state, I would imagine, about how they are accomplishing things. And I'm just wondering if it's a case that they just have more vaccine than we do and are able, you know, to get it into arms faster. Again,
I know that there are places, yes, I talk to health officials across the state every day, multiple times a day. We have a meeting with our local Rancho, Northern California group once a week, in addition to multiple other calls on a daily basis with state health officials. What's going on in different places, you know, it is, again, that's their local jurisdiction, and how they decide to move through can be done very locally. We had a plan in place here that we have been sticking to. We have not changed it. It's been working well. It's gotten through our phase 1A. We're ready to move on to phase 1B. And, you know, I know there are many jurisdictions where they have already moved on to phase 1B, and there are many who have not even moved into tier 2 or barely into tier 2 of phase 1A. So there is a lot of variety, and that is, I don't know why that is specifically. I think that would be a question for someone else at the federal or state level, why we're having so much variety. What I can speak to is what's going on here locally in Humboldt County, which is that we have enough vaccine for phase 1A. We're moving to phase 1B. First will be 75 and older, and then we'll move on to teachers, law enforcement, fire, and food and agriculture.
I mean, I get it's not unreasonable for residents, I think, of Humboldt to wonder exactly why their neighbors are getting vaccine when you know, in certain tiers and certain categories when they are not. I don't think that's and I'm surely someone must be looking and thinking about these things at the federal or state level. You say someone will be thinking about those things.
So this is, you know, we were given an amount of vaccine from the state. Well, first it came from the federal government. It was given to California. California allocated out to all the local health jurisdictions, and Humboldt County is one of those.
Yeah.
We took what we were offered. We've accepted everything we've been offered. We have never declined vaccine, and we are allocating it out to our healthcare partners to give in the order that was laid out in the phases and tiers. When we have enough vaccine and move on to other phases and tiers, we will absolutely do that.
Yeah.
One reason for that, Hank, why other counties might be moving through tiers differently and different timing is that not everybody has the same number of people that constitute those tiers. So we know locally what our healthcare workforce is for tier 1A. I don't know what Mendocino's is or other jurisdictions is specifically to tier 1 or for phase 1A. So, you know, jurisdictions that are moving on to teachers now, maybe they've been done with phase 1A for quite some time because they don't have as many. We don't really know the specifics of each county for that reason. So it's just, it stands to reason that there would be some variation across counties and across jurisdictions for that reason. Like Dr. Hoffman said, you know, we're sticking to the plan that we originally had around focusing and prioritizing 75 and older. We don't have enough vaccine right now currently to also open it up to 65 to 74. As we get more vaccine, those additional doses that we're supposed to be getting, we are going to look at how many people in 75 and older are choosing to get the vaccine, how many are not. And as we have more vaccine available and we can look at those numbers, adding 65 and older and working through the rest of the tiers to get to teachers, you know, clearly this was a little concerning that now we have to simultaneously plan for the sectors, the teachers and healthcare educators, which are critical for this, right? We want schools to get moving, and so does the governor, obviously has stated that. So I guess, you know, as we get more vaccine, we will open it up as quickly as we can to other groups. I think the variation across counties is a reasonable thing to occur.
Yeah. Okay. Thank you.
Thank you, Hank. Isabella Vanderheiden, Time Standard.
Hi, thank you. So I would kind of piggybacking off of that, I would like to know when exactly the county would expect to begin vaccinating people 65 and older, and also will vaccinating people over 65 take place at the same time as vaccinating other prioritized populations, and also how many people are in that age group, and what would kind of be the approximation on how long that would take?
Yeah, really great questions, Isabel. So we will definitely be vaccinating groups in tandem, not just, you know, wait until you're totally done, but we do want to wait until we've offered everyone in that group a chance, and then we'll start to roll into the next group. So there will be overlap, certainly, of each group. So that's what the decision today is, to open up 1B, because we know we've had enough for 1A, then we can start, and we haven't finished, obviously. So there are many healthcare workers out there who have not had their vaccination who still want it, but we know that we have the resources to get it to them, and we can start to roll it into the next phase. So those overlaps will definitely occur. Time frame is, it's really difficult to give specifics. It will absolutely depend on the number of vaccines. Certainly opening up 50% of our second doses has accelerated that time frame, and we expect that in the coming weeks, at some point, if what we were told Tuesday is true, we will get all of the doses at once as opposed to half. So we've been getting 1,000 to 2,000. We are preparing to get 2,000 to 4,000. So that's why we've ramped up efforts this week to really prepare for next week. And then the weeks to come, if we need to keep scaling it up, if we see those numbers coming through to Humboldt County. So I can't give specifics, but except to say that when we prepare, when we're wrapping up one phase, we've already started to prepare for the next phase and tier, and we're thinking about the next one past it. But until we can't really plan out too far in advance, because we just don't know what kind of vaccine and resources we will have for those folks. It's kind of like waiting in line. You know, we know the line and we know where we are in line, but we don't know how fast the line's going to move. So we will do our best to let people know as they approach the front of the line to get ready. And then when you're at the front of the line, you'll be definitely told you're at the front, like today, 75 and older, and how to get that vaccine once you're at the front of the line.
I think you also asked the numbers, right? Like how many people are in the 64 to 65 group, right?
Yeah. So 75 and older is 10,000 in Humboldt County, and 65 to 74 is about 16,000. So this was the reason for deciding that we could not accommodate more than doubling that group at this time when we're only getting a few thousand doses per week. And as I said, we only have about 1,700 first doses right now. We've given out the vast majority of them, but we will accommodate and make more first doses by going into those second doses as we've been instructed. And I think it's a good move to keep us moving and keep us on pace. And I'm hopeful that the federal government will come through with this promise to get us more vaccine very shortly.
Great, thank you. And I'm also wondering, how will people need to sign up? Like, how will that process take place, and kind of how will those people be chosen within that?
Yeah, so great question, Isabella. So like I said, I've met with all the healthcare providers. There are only certain groups that can vaccinate for COVID-19 currently. Luckily, they do include the major healthcare players in Humboldt County. So they know they've been preparing for this. They now know to get ready for next week that they're going to call their patients and bring them in. I have instructed them, if possible, to bring them in based on risk factors. So people who are 75 and older with risk factors, which many of them already had that list together because we've been talking about it for weeks. To start with those folks, invite them in for their clinics, and then move through. But with the, really, the goal is to fill up the vaccination clinics that they have to their maximum capacity. So we set parameters, we try to meet those goals, but we don't let those slow us down too much either. We want to allow for some flexibility so that we keep moving through it quickly.
Great, and one more just kind of follow up on that is, will any local pharmacies begin offering vaccines, and if so, where? Great
question. So currently we do have one local pharmacy who is doing invite only through, we notify them from public health who to invite. So these are still phase 1A healthcare workers. So some of you might have been invited to that local pharmacy to get a vaccine. We know that there has been a bit of a delay and a backlog in approving other vaccine providers. I know the state is working on that and trying to get more people. There are many in the pipeline for Humboldt County that will hopefully come on in the next week or two. And then again, that'll expand our capacity. And so many people who don't go to, say, a specific vaccine provider, who say your doctor is not a approved vaccine provider, they would be able to go to one of those pharmacies once they're approved to get their vaccine based on their age.
Okay, thank you.
You're welcome.
Isabella. Taylor Elliott, Redwood News.
All righty, can you hear me?
Yes.
Can you hear me? Are we good?
Yes, we can. Thank you.
Okay, awesome. So my first question is, or my question rather, you've talked about obviously the county is ramping up vaccination efforts. Are there any plans for mass vaccination sites? Kind of maybe something similar to like the site at Redwood Acres for testing? And then kind of on top of that, is public health, that clinic that you guys are running, right now I know it's for phase 1A, but are you guys going to be expanding on that in any way as we open up vaccines to the broader population of the community?
Yes, so we currently have a mass vaccination clinic that has a capacity of about 750 vaccines given per week through public health. That is now in its second week. And we have plans, once we heard this plan from the federal government on Tuesday and realized that we would very likely be getting a lot more vaccine very soon, we immediately went into action to increase our availability for vaccination. And so we're planning a second vaccination site potentially, or expanding the one that's already there next week, which would include hopefully expanding our capacity through public health for up to 1,750 vaccine appointments next week.
I would just add real quick that as we're looking at the additional sectors and groups that are coming down from phase 1B and phase 1C in the future, part of public health planning for mass vaccination clinics is looking at adding the vaccinators that are at the clinics, the amount of vaccinators, and the various locations. So Dr. Hoffman was just talking about either adding additional staff or additional vaccinators at our current clinic, in addition to an additional site, and beyond that, additional sites beyond one additional site. So yes, we're currently working, the EOC, the Emergency Operations Center, and Public Health, our vaccination task force team, are working together to secure locations, identify vaccinators, whether they're from the healthcare system or the volunteers that we currently have, to expand. So yes, those are all happening in the works.
Yeah, and basically we're looking at any way to get more appointments for vaccines in Humboldt County possible. And I'd say that so we're trying to match the number of vaccines coming in with the number of appointments. And if that number gets to a very large number, it might require something like that Redwood Acres site being turned into a very large mass vaccination clinic. So that discussion has been had, but until it's necessary, we are meeting the capacity with what the plans we have currently.
So then following up on that, I know you mentioned that there are only a number of people right now that are authorized to administer the vaccine and that some are kind of pending as far as requests. Do you have any idea of when you guys are expecting more places to be authorized?
I'm not sure of the exact time frame for all of this. We do have our public health vaccine team working with those folks and the state to try to see what can be done to speed that process up. But I cannot speak to the exact time frame of that. I'm sorry.
Okay, thank you.
Thank you, Taylor. Riley Carroll from North Coast News.
Hi there. Thank you so much. So just quickly, as we're wrapping up phase 1A, are the people prioritized in each tier? Do they lose their prioritization as the tier closes, or if they opt to get a vaccine later, do they take precedence over whatever the current tier is?
Yeah, great question, Riley. So if you're a phase 1A worker who decided to delay or wait, or you weren't sure, we're not saying we're closing the door on you. We definitely, that it still stays open. So your place in line, you don't lose your place in line, so to speak. But I would say that you might not be able to get it as quickly, because as each phase opens up, it is bigger and bigger groups. So I would encourage people to take their turn in line when it's their turn, because if you wait, you might have to wait a little bit longer if you try to jump back in later on. But we're not going to turn anyone away whose turn already came.
Sure. Thank you so much. And then if you don't mind, just big picture, since vaccines now been rolled out, what is a time frame for when we start to see effects of this? Now it's declining, the case rates declining. When might we start seeing that?
Yeah. So I think that, we have to remember a couple of things here about this vaccine. The vaccine right now is approved for individual protection. So when an individual gets their vaccine, they're protecting themselves from COVID-19 and their a severe disease, hospitalization, and death is the ultimate thing from this disease. So we do not have sufficient evidence yet to say that the vaccine will prevent the spread. So someone could get COVID and not be as sick and be able to still spread it. So nothing at this point is going to change about the measures that we're taking to prevent the spread of this disease, like masking, social distancing, hand washing, limiting gatherings. All of that needs to continue. When we have enough evidence that this vaccine will reduce the case counts and we see that reflected in the epidemiological data, I think we'll start to roll back each thing as we're comfortable. When that is a really difficult thing. I think if we're complete optimists, it could be sometime later this year. Some people have said into next year. Some people think we might be wearing masks for the next several winter seasons. I think, if we saw what happened with SARS, a decade ago, we know that people were wearing masks in Asia for many seasons after that. So I think time will tell, but this will hopefully lead to more normalcy towards the end of this year and into next year.
Thank you very much.
Thank you, Riley. Daniel Mintz, Mad River Union and The Independent. You'll have to unmute it. Yeah, there we go. Okay.
Thank you. Now, I think you said that 10,000 doses of the vaccine have been offered so far and 7,300 have been given. So does that represent the level of vaccine uptake?
It's a great question, Daniel. It's really hard to give you exact numbers on that. We are targeting about 70% of people because we know there will be declination rates. You know, I know some healthcare entities have had uptake as much as 90% of their facility took it, and others had lower, like 60%. That 70% seems to be a number that a lot of people land on for uptake of the vaccine.
Okay. And other than that, you know, as far as the logistics of this, through your presentation and these questions, most of my, or all of my other questions have been answered, but I do have a question about something more general in that public health officials are and have expressed really a lot of confidence in the vaccine as the tool to end the pandemic, but the virus has recently undergone significant changes, and there seems to be an emerging debate about vaccine effectiveness. And so there's some dissonance there, and I have two questions related to that. Are we rolling out vaccination quickly enough to outpace virus evolution? And to what degree should we be prepared for other scenarios besides an outright end to the pandemic through vaccination?
Great question. So yes, we're all aware there are new virus strains out there. You know, the level of which they're circulating in each community is still a little bit of an unknown. In the UK, obviously it's widespread. We know it's in the US, we know it's in California. There have been pockets that have been detected. There is surveillance going on statewide for California. One epidemiologist report that I saw said maybe about 1 in 1,000 people in the United States has been who has COVID-19 has the new strain from the UK. So it's still quite small, and is, you know, I don't think we should suspect for any reason that it's here in Humboldt County circulating widely. Are there a few cases of it? It could be. People travel from Humboldt County, people travel to Humboldt County. That's how it got here in the first place. But it's certainly, we have no reason to think it's widely circulating here in Humboldt County or Northern California. To your second point of the vaccine efficacy, it is extremely efficacious vaccine. This is the most efficacious vaccine I've ever seen. 94% is extraordinary for a vaccine. And to date, we have no evidence to suggest that it will not prove effective against the strains that we're seeing. So it would be speculation to go further than that at this point. And yes, to your question about speed, this is a race. This is why we're here today, to give everyone information. That's why we've called together our healthcare leaders to implore them to keep moving quickly, and it's why we're releasing, you know, extra doses to keep moving as quickly as possible through this and get as many people vaccinated in a timely manner.
Okay, one follow-up. So 94% effective in trials, no evidence to suggest that these variants, you know, will interfere with vaccine effectiveness. Do we have evidence to suggest that the vaccine won't be affected negatively by these variants?
I think,
I mean, isn't it just as speculative to say that the vaccine will work as it is to say that it won't, because there's no data to support either one?
no, I think there's absolutely evidence to support that it is efficacious against the vast majority of coronavirus that's circulating in the world right now. Will it be? It's speculation to say there could be variants that are that would not work for these particular vaccines. and I do not know of any evidence to support that speculation.
Okay, thanks.
Thank you, Daniel. I see K-Mud Radio joined the call. I'll ask you to unmute, introduce yourself before you ask your question.
Okay, thank you so much, Mariah, Dr. Huffman.
Oh, I think we just lost you, Lauren. Hang on, I'll ask you to unmute one more time. Give me a moment.
Okay, is that better?
Yep, we got it.
Excellent. And, you know, as Daniel stated, thanks to everyone for asking such great questions on the vaccine. Dr. Huffman, right now, is the Pfizer vaccine the only vaccine being administered, or is Moderna also?
Yeah, thank you. Great question. Yes, both are being administered in Humboldt County. They have been from the first week. We have a very large freezer at St. Joseph's Hospital for the Pfizer vaccine, which is the one that requires ultra low temperatures. And the other ones can be shipped directly to clinic sites. The Moderna can be shipped to clinic sites, which is much easier for handling.
Oh, oops, sorry, I didn't realize I should probably, I will not unmute. Sorry, Mariah, I'm making more work for you. What is the deciding factor on when choosing which of the vaccines to use?
Yeah, so both vaccines are pretty similar in terms of their efficacy, side effects, and the major difference is the storage and handling. There's a slight difference too in the time period between the first and second dose. The Pfizer dose is 3 weeks. The Moderna dose is 4 weeks for the second one. There are some logistical reasons that we have put Pfizer in certain places like the hospital. Obviously, St. Joseph's Hospital, because that's where the freezer is located and it's easier to get the vaccine out of that freezer. They have mostly done Pfizer. Also, most of the hospitals did Pfizer because those were the doses we got early on, and the clinics mostly have been getting Moderna, but that could change. It's really a logistical question more than it is a medical or scientific question.
Are you expecting any changes in the rollout of vaccines with the upcoming change in our federal administration?
Well, I think one thing we've learned about the vaccine effort is we got to be prepared for change. So there has been a lot of talk about this for at least a week or two, with the UK deciding to roll out all of their vaccine. I think that we will wait and see. I don't know specifics on Biden's plan, but there could be more changes to come, and we will adapt. And I think that the point of today is to let people know that we had a good plan. We accepted that they made different changes and recommendations, but we didn't feel like that made sense here on the ground, and we decided to stick with our plan locally because it makes the most sense for our population and what we have here locally. And but depending on any new recommendations or changes, we would address those as they come.
Thank you. And one final question, something that was brought up on last night's news. Soham Health announced that a large number of their positives have been travelers or tourists. Did the Department of Health and Human Services contact those individuals? If so, what is the protocol for people that do not live in our area but test positive here?
Michelle, do you want to address that?
Yeah, sure. Not speaking specifically to those individuals, but in general, yes, we when we have a positive case and it's from a different jurisdiction, often we contact that jurisdiction in the individual to notify them of their positive. But then it really falls on that jurisdiction or where they live to do the follow-up. And they're instructed in terms of the isolation orders, what that means in terms of staying in isolation for the period of time. And we answer their questions and whatnot. But then they go to where they came from and they are in isolation there. They don't stay here if they're not planning on staying here.
Okay, thank you both.
And if I just add to that, so we, whenever we get a positive from out of the area, we contact them and then we forward that on to the local jurisdiction to let them know to continue the follow-up, and we will always follow up until we know that jurisdiction has taken over the case.
But quick follow-up. So at this time, those folks are advised to return to their jurisdiction, even if it's hours away. So they will be positive and traveling.
It would depend on the situation. I would say that most of the time, if they are able to still stay here in place and that's the safest route, that's what we would do. And we have made arrangements for travelers and folks who are just coming through the area to stay in various locations. But it's a case-by-case basis, and that's decided by our public health nursing team, depending on the safety and concerns in that given case.
Excellent. Thank you, Dr. Hoffman and Director Stevens.
Thank you all very much. Everybody's had a chance to ask their initial questions. If anyone has any additional vaccine-related questions, I'll just run back through the list. So, Thad Greenson.
Yeah, I have a couple follow-up questions to things that have already been asked here. The first is, understanding that you guys expect healthcare providers to, as we move through phase 1B, and specifically the 75 and older group, is are expecting providers to contact their patients who fall into that group. But as we move into employment sectors, like educators or first responders, what's the plan for getting those folks in line? I doubt that healthcare providers can sort their patients based on that type of data. So have we gotten there as far as figuring out how those folks are going to sign up or be notified or put in line?
Absolutely. And so without giving a specific plan yet for that group, because we haven't put it out there yet, and talk generally about it, we'll start with phase 1A, which it required a lot of work from our public health staff to gather information from the different entities in healthcare. And that included surveys that went out to everyone in healthcare to ask them how many people were in their organization, what the level of risk they had, and did they want the vaccine. So that same sort of surveys are going out to the other industries as we get closer to them, so that we can gather that kind of information and prepare. So whether or not those people will go to their own doctors or come to a public health clinic, or if we have a mass vaccination clinic by that point, of the size we were speaking of earlier, that's the sort of thing where we have to wait and see what the capacity is, how many vaccines we have, how many we can give out in a certain period of time to those people, and how to put them in line in their industry. But that work is going on right now, yes, to gather that information and prepare them for their space in line.
All right, Hank Sims, any follow-up questions?
No questions from me. Thanks.
All right, thank you. Did you have something to add, Michelle?
I think Thad had another one.
Oh, gotcha. I'll give you another chance here, Thad.
Thanks very much, and I apologize for doubling up. But yeah, my other question is, and I alluded to this before, but this does put a pretty heavy lift on healthcare providers to add a new function of operating vaccine clinics at a time when they're stretched in a variety of other ways, financially and staff-wise. So I guess it's kind of a two-part question. Is just do you feel that local healthcare providers are kind of up to that challenge, and then also that are they doing their best to meet that challenge currently?
Yes, I think they are up to the challenge, and I think that we've been working with them this whole time. to prepare for this moment. And we all want the same thing. We want this to end. We want to get vaccine out there as quickly as possible. So this is an amazing community. We're all coming together to make this work. Is it easy? No, it is absolutely not easy. Nothing about this pandemic has been easy, and the vaccine on top of it is recognizably a burden upon another burden. But we will get through this, and yes, I do think they're up for it. And you know, we'll, as time goes on in this vaccine effort, we'll look for ways to spread that out as best we can across as many places as possible. Because yes, we don't want to burden just one group or one sector.
It's definitely a heavier lift for them, I think, to do a more of a vaccination clinic for patients that are not theirs, right? That's not their medical home, and we recognize that. And so it's a little bit more manageable of sort of an ask or a role to manage their own patients. So we're really, that's really what we were talking most recently about, is if they can manage their patients and expeditiously get those folks done, that would really be adding to the support and the resources that's needed to get everybody done. But like I said earlier, around organizing and planning for the larger clinics and more locations, that's where the folks that don't have a medical home, or you know, their primary care provider isn't able to, or for a variety of reasons, then we would want to be able to capture them too. So we have contingency plans, right? Providers doing vaccinations for patients, and then these clinics that we're setting up.
All right, Isabella from the Time Standard, do you have any additional questions?
Yes. So, hi. So I'm wondering if there have been any reports of adverse reactions to the vaccine locally, and if so, what were their symptoms?
I have not heard of any severe adverse reactions locally. A couple of smattering of mild cases of, you know, some hives or a rash, or, you know, certainly I think that, you know, this vaccine, like any vaccine, has known side effects, and you know, probably upwards of about 20 to 30% of people will have at least a little bit of those. A sore arm is very common with any vaccine. Maybe some body aches or chills, also quite common. Occasionally a mild fever, less common. Severe reactions like hives or allergic reaction are quite rare. They are a little bit more common with this vaccine than some other vaccines. And for that reason, we do a 15-minute monitoring period after the vaccine for everyone. And if you have a history of allergies, severe allergies or severe allergic reaction, we watch you for 30 minutes. And if you've had a history of anaphylaxis, which is the most extreme type of allergic reaction, you should really consult with an allergy specialist before you get this vaccine, to talk about the pros and cons and the risks, benefits of getting the vaccine.
I think that's a really important point too, is why we're not doing drive-through vaccination clinics, like where people just stay in their cars. That's the primary reason why that's not happening. And so I've seen folks asking why we're not doing that just in the community, right? And I think that's a really important point to make, is that there's a clinical piece to this that we have to be mindful of.
Yeah, it's important to recognize that this vaccine is not your typical vaccine. This is not the flu vaccine. You know, we have to give it in this monitored situation. It's new, so we just don't know everything about it, so we want to watch more closely. And the storage and handling requirements of both vaccines, Moderna and Pfizer, are much more stringent than any other vaccine. The providers who are approved is, you know, not like a flu vaccine where you can get it in any office. You have to be approved. But over time, as we get more experience with this vaccine, with these vaccines, the two of them we have right now, the providers get more experience. They get more comfortable. There will be more providers. And we will, I'm sure, open this up to a broader range of vaccination sites across the county.
Thank you.
All right, Taylor from Redwood News, do you have any additional questions?
No questions for me.
All right, thank you. Riley from North Coast News, do you have any additional questions?
I do, if you don't mind, just quickly. Obviously, it sounds like, as is expected, a lot of the theoretical and what can actually happen. So the 65 and older that's now been moved up, we don't actually have the capacity to vaccinate time. Is that a Humboldt specific problem, or a smaller county problem, or are we seeing that the actual expectation of who you can vaccinate is not able to be met due to allocation of the vaccine?
Sure. You're breaking up just a little bit there, but I think I caught your question. So you're just like we've seen mentioned earlier that some jurisdictions have moved on to phase 1B and are already starting to vaccinate some teachers. Other jurisdictions are still in the middle of phase 1A, and I've heard some say we are a month away from finishing phase 1A. So you can see there's a variety of different outcomes. It really comes down to what's happening locally. So this morning on a call, most of the jurisdictions, this was a small county health officer call, most of them said we are sticking with 75 and older because that's what we have the capacity and the vaccine for right now. There were a few handful that said they felt like they had a capacity for 65 and older. It really comes down to the local conditions, and we felt like the local conditions did not allow for us to open at 65 and older. And when they do, we will open it up.
Thank you.
Thank you, Riley. Daniel, from the Mad River Union and Independent, do you have any additional questions?
No further questions. Thank you for doing this.
Thank you. Lauren from KMUD News, any additional questions?
Not a question, but Dr. Hoffman, I'm wondering for our listenership, if you could just kind of go over, you're saying this vaccine is different, talk about what an mRNA vaccine is and kind of explain the spike protein. Thank you so much.
Sure. Yeah, great question. So yeah, let's get technical. So this is a brand new type of vaccine called an mRNA, messenger RNA vaccine. So typically a vaccine contains a protein. We call that an antigen. That antigen is injected and then the body recognizes that antigen or that protein and makes an antibody against it, so that when you get the actual virus or bacteria, your immune system can recognize that that virus or bacteria right away. In this case, we're taking an mRNA, messenger RNA, which is a piece of genetic material, and it's sort of I was actually describing this to my 9-year-old daughter last night. It's as if you took a book and you copied the book over here in handwriting, but you're not going to hold on to that book for very long, that copy for very long. You're just going to throw it away because it was just a copy. So it's a copy of the genetic material. It goes into the cell reads it and makes that protein, in this case the spike protein. So your own body is making the spike protein, and then your immune system recognizes it and makes the antibody. So in that way, it's the same as any other vaccine. The difference is the way that the protein gets in there. In this case, it was much faster and simpler to have our own bodies produce that spike protein than it was to try to get a stable vaccine, because the biggest part of a vaccine is creating a stable environment for that protein to stay around for long enough. So that's how this one is different. And it's really revolutionary. It's a fantastic method for creating a vaccine, and I think that it's really going to open the door for a lot of vaccine discoveries going forward as well.
All right. Thank you all very, very much. Anybody has any additional questions and they want to raise their hand, I can select individual reporters. And seeing none, I will just say.
Pat's got his hand up.
He's got his hand up. Here we go. All right, go ahead, Thad.
Thanks very much. Yeah, just real quickly, and I know this isn't directly in Humboldt Public Health's purview, but I'm wondering if you guys can provide a brief update on efforts to vaccinate nursing home residents locally.
Sure, thanks, Todd. So the nursing homes were part of a CDC partnership with pharmacies at CVS and Walgreens. And that partnership was forged through the federal government, through the CDC, and they were given their own vaccine apart from the counties. They did get off to a little bit of a slow start, and but the first one that they did in Humboldt County happened on the 4th of January. And they have done a few other rounds already of other skilled nursing facilities in Humboldt County. So it's underway and going. Most of the skilled nursing facilities have now had their vaccine offered to them. We did also, as public health, go in early. We had enough vaccine and we didn't want to see delays for the staff. So we sent public health nurses out to those facilities in late December to offer vaccine to the ones that were being asked to wait till the middle of December. And that way we could at least offer them vaccine early if they wanted to take it. And many took us up on that. So we'll continue to support and augment that program as much as we can in the future.
Great. Thank you very much for that.
I don't see any additional questions. So thank you, Dr. Hoffman. Thank you, Director Stevens, for joining us. And thank you to everyone for participating today. Have a great day.
Thanks, Mrna. Thank you, everyone.